Good afternoon, everyone, and welcome to the webinar. I'm Holly Schroeder. I'm President and CEO of the Santa Cruz Valley Economic Development Corporation. SCV-EDC is a unique public-private partnership really focused on growing jobs here and recovering the jobs that have been lost due to COVID. Throughout 2020, SCV-EDC has worked to encourage a safe and healthy reopening of the economy. We worked with the three companies that you are going to hear from today and introduced them to key organizations in our valley that could use their technologies to reduce the risk of COVID-19 transmission. These are companies that have been working with hospitals and medical facilities for years, as well as with the Defense Department to protect our troops in unknown situations. And so we're going to be talking about how these proven technologies and how we can adapt them to respond to the COVID-19 pandemic. But before we hear from those companies, I want to introduce someone who is just as passionate about these types of solutions as I am, Mayor Pro Tem Lorene West. She and I believe that these types of solutions that you're going to hear about today can help us reduce risk in our current situation, and that doing so will also improve indoor air quality generally, and that has results of improving the performance from workers and students, and will prevent the spread of this virus and others that will come in the future. Lorene's been on this Santa Cruz City Council since 1998. She is a tireless advocate for our region. So thank you for joining us, Lorene. Appreciate you being here.
Thank you very much, Holly Schroeder, and it's my pleasure to welcome everyone today. This is an extremely important day, and I just wanted to kick us off with a little short commentary about ultraviolet C. It has been almost a full year of living isolated and dealing with impacts on our lives, jobs, and our businesses, and our family, our loss of social contact, and the terrible concerns for the welfare of our children. Today, we will bring to light, literally, the information on the already available and proven 21st century technology to move us forward safely with clean air through ultraviolet C technology. We have three companies based in Santa Cruz with cumulatively more than 150 years of experience in ultraviolet technology. They're shipping equipment all over America and the world. The equipment destroys 99.9% of virus microbes and bacteria when installed in HVAC systems in your building. Air is necessary for life, and clean air is absolutely essential for your good health. The city of Santa Cruz immediately began proactively installing ultraviolet light technology into heating and air conditioning systems at citywide facilities. We know viruses mutate constantly and very quickly. The variants are incalculable, but UVC will destroy them all. UVC technology is proven, it is available now, and there is no need to wait. Three local companies in Santa Cruz, UVDI, Applied Companies, and UV Resources are all well recognized. Their products and UVC equipment are protecting hospitals, including our own Henry Mayo, commercial buildings, government facilities, anywhere people congregate. It's the answer for theaters, restaurants, churches, anywhere people need to be in a building. Professor Hadass Mamain of Tel Aviv University led a key study on ultraviolet light and its applications. She said that in less than 30 seconds, 99.9% of coronavirus is destroyed. The application is applied in ventilation systems, robotics, vacuums, and HVAC systems, and has a huge future for our public health worldwide. We can't hide from something we can't see. However, we do have the tools in the 21st century toolbox to destroy this virus and future viruses by being prepared with this technology right now. I have worked for almost a year pushing to get this information out in conjunction with Holly Schroeder of the SCV-EDC and the SCV Chamber of Commerce, and of course, the City of Santa Cruz. The information these companies will provide is essential for our return to a normal way of living, not isolated and not unprepared for the next viral attack on public health. Let's begin the dialogue today so we can all be back together while protecting our jobs and averting future closures in the future. How many times can we take a hit and stay strong? For everyone and everything we hold dear, let us use the tools to maintain a strong, vibrant, and healthy community. I want to thank you all for participating, and I look forward to hearing questions and answers and sharing this very important technology with the public.
Well, great. Thank you, Mayor Pro Tem. Really appreciated to your leadership on this issue. I also want to thank Peter Warda, Santa Cruz Valley Chamber of Commerce. They are co-hosting this webinar series with us. And we believe this is the third of 3 that we've been doing. And Peter, I believe that the former 2 are posted on the Chamber of Commerce website and YouTube. So I want to thank you for partnering with us on that. But let's start getting into things. And I'd like to ask our 3 panelists here first to start by just doing a quick intro, a brief intro about you and your companies. And Dr. Mather, I'd like you to, why don't you start? You're on the left side of the slide there. So why don't you just a quick introduction of yourself and UVDI.
Sure. Thank you, Holly. So my name is Ashish Mathur. I am currently Vice President for Innovation and Technology at Ultraviolet Devices. So of course, we are in Valencia, right by Rye Canyon Road. So we've been in the UV business for the past 70 years. So we started for water disinfection, and since then have deployed millions of UV systems for water, air, and surface disinfection. As Holly mentioned, that this is a recognized and proven technology, so it has been adopted widely, and of course, healthcare settings being the highest usage, and then lately in more commercial installments as well.
Great, thank you. Joe, why don't we have you go next? Applied Companies, you have a little bit of a different background than the other 2.
Yeah, so we're more of an adopter. Applied Companies was founded in 1958. We specialize in the design and manufacture of custom HVAC systems for military, commercial aerospace applications. And so as a result, we are constantly required to look at indoor air quality, disinfection, air particulate as part of our government services to both the soldier and facilities. As a result, we are constantly purchasing UV lights and incorporating them into our overall unitary package systems for delivery to our customers.
Great, we'll go into that a little bit more. And then last but certainly not least, Dan Jones with UV Resources.
Thanks, Holly. Yeah, my name is Dan Jones. I'm the president of UV Resources. We've been around for about 15 years. I've been in the UV industry for about 23 years. And our products are applied primarily in the HVAC systems, ductwork, and upper air in rooms. So yeah, the proliferation of UV over the past year has been pretty huge. And I know the industry worldwide, as well as everybody in general, is looking to apply UV in these applications in commercial buildings, et cetera. So that's what we do.
That's great. Yeah, and certainly the private sector is recognizing the opportunities and certainly the risk reduction that can come from UV. And so, Dr. Metter, why don't you just do a quick, since we keep talking about it, why don't you just do a quick introduction to the UV light technology and what do we know about it as it relates to viruses generally and then specifically for COVID-19?
Sure. So yeah, this would be like you could give a small 101 on UV and how it's applied. So So when we hear the term UV, we tend to think that is the UV rays radiating from the sun, and which gives us a skin tan or even a skin burn if we get exposed to it too long. So this UV reaching the Earth is part of the UV light spectrum emitted by the sun. So the UV light is actually an electromagnetic energy, which is naturally emitted from the sun as part of the spectrum with a wavelength shorter than the visible light. So UV is invisible. So the light spectrum ranges from 100 nanometers to 400 nanometers. Don't worry about the units, but it's way small. So within the spectrum, there are actually three further classifications of UV light. One is UVA, which is a long wave, UVB, which is medium wave, and UVC is a short wave. Of all the radiation from the sun, majority of this radiation that reaches the surface of the Earth is primarily UVA and some UVB. So nearly all of the UVC radiation is, because it's a shorter wavelength, is absorbed by the ozone layer above the Earth. So UVA, of course, we get tan, so it is used in tanning beds. UVB is used as a treatment for skin conditions such as psoriasis. And we are primarily talking about UVC. So UVC radiation has the highest energy amongst these and is capable of directly damaging the DNA and the RNA backbone of the cell of a microorganism. So UVC is also referred to as a germicidal light because it is basically killing the germ. So how is it produced? So UVC light is produced primarily by low to medium pressure mercury lamps, which coincidentally radiate about 95% of the energy close to the DNA absorption peak of these microorganisms. So since these microorganisms absorb this UV light at this light, they get inactivated by this light. So most single cell microorganisms such as viruses, bacteria, and fungi, they're all susceptible to the UV light. While some are more susceptible to the others, but pretty much all respond at the required dose, which is required to inactivate them. Amongst these, in general, viruses are actually the most susceptible and the most easiest to inactivate compared to these other microorganisms. So someone actually got a Nobel Prize in 1900 when they discovered that UVC light is damaging to the DNA. As I think it was a Danish scientist called Niels Finsen. So it's, since 1900s, UV has been applied in a lot of applications, commercially more in the last 40 years for disinfecting drinking water, wastewater, and then I would say in the last 2-3 decades, disinfecting the air in buildings inside the HVAC systems, and then for disinfecting surfaces and hospital rooms, and of course in healthcare settings. So when COVID started last year, everyone was asking if UVC would be effective to disinfect SARS-CoV-2, which is responsible for COVID. And then of course the scientists said they determined that the SARS-CoV-2 virus is structurally very similar to the previous coronavirus strains, such as SARS-CoV-1, MERS-CoV, in terms of their genomic characteristics, which is important for UV-induced damage. So there was and there is sufficient evidence proving the efficacy of UV for these coronavirus strains, which is applicable for SARS-CoV-2 then. So in addition to that, some of the preliminary UV studies came out last year confirming that UVC is effective against the live SARS-CoV-2 strain as well. So, and then that led to the widespread adoption of UVC since COVID started. So we at UVDI and some other manufacturers have actually validated our UV systems against SARS-CoV-2 for both surface applications as well as for moving airstream applications. So by conducting these tests at independent BSL-3 labs, those are the only labs which can handle these live strains. So they're all backed up, but we were fortunate to get confirmation that UV systems like ours are indeed very effective in getting up to, like Lawrence and Holly said, up to 99% or greater disinfection for SARS-CoV-2. So I would say today there are two main applications how UV has been used in the
I'm gonna stop you there,
Yeah.
Dr. Matur, because I want to talk about some of these applications. And Dan, I'm gonna come over to you. And I think what Dr. Matur did is really great in sort of explaining, the different types of UV light and the effectiveness and what we know in terms of the research on that. But then how does that translate into putting it into a space? You mentioned in your intro you do a lot with HVAC and upper room. What does that mean? And maybe just talk about what it would mean for people who own buildings or work obviously in buildings.
Sure, and it all comes down to how the UV gets applied and how it will treat the air either within the room or in the duct or in the HVAC system. And as Ashish was mentioning, it's been applied for the last probably 4 decades in HVAC systems for other purposes, primarily to keep coils clean. The difference between that and this is now we're looking at something where we're trying to kill it or inactivate it in a moving airstream. And so it depends on what the dose is. So the typical application for UV now in commercial buildings is in the duct or within the HVAC system. And again, as I mentioned, it all comes down to the dosage. And as Ashish was saying, the current SARS is very similar to the past SARS viruses, and therefore we know what dosage will be necessary to inactivate these pathogens. So maybe something where you would walk into a building that has UV in their system, you would never even know it because it's going to be above the ceiling in the duct space or up on the rooftop in the HVAC system. Another application is in the upper room or upper air of a space. And this goes back to the 30s and 40s where fixtures mounted to the wall in that space and creates a kill zone in the upper part of the room. That UV energy does not come down into the lower part of the room, it stays in that upper part. And so as convection, either natural or mechanical, brings those microbes up into that space, the pathogens are irradiated by the UV and killed. And today, that's primarily how it's being used. And upper air had been, as Ashish had mentioned, primarily used in healthcare settings and things like that. Now we're seeing it more commercial settings where your groups of people are together. They're wanting to put this in, including classroom.
We're going to come back to the classroom part, but I'm going to go over to Joe, because Joe, you've applied, you do a lot in the, Dan just talked about the circulation of air and HVAC systems. You do a lot of work with filtration and ventilation for military applications, among others. Maybe talk about how these pieces fit into the ventilation needs and the filtration activities going on in buildings and other settings.
Yeah, thank you, Holly. So, from our perspective, it's how we incorporate the UVC light into our overall product to provide the most protection to the soldier, to the end user, whoever's going to be in the conditioned space. And so, there's different ways to look at it. There's upper air UV, which is fantastic for rooms and highly recommended for schools. We can talk about that later. There's the kill capture method where you're radiating a coil or an actual HEPA filter, and the dosage on the wattage level of the UV light isn't high enough to kill it in the first pass. So you capture it on a filter and you dose it for a longer period of time, which also gives the ability to kill the virus. So what we try to do here at Applied is find the best application for what we're trying to do. And, we're already and have been for the last, 30 plus years doing nuclear, biological, and chemical filtration for the military. And so what we're bringing and what we're talking about doing here is nothing that hasn't been done for years and years and years in a mobile military platform. And so to take that and put it in a stationary building, it's really not a heavy lift.
Yeah, and Joe, I'm going to pick up on what Dan said, because you really got interested in sort of these applications because of what's happening with schools, which is really interesting because, of course, this week we're getting news in California that elementary schools and LA County can start putting their plans together to reopen. And you found some research that really talked about this as part of a reopening process. I believe it was some research from Harvard. Maybe talk a little bit about, what is known in that setting.
Well, yeah, I mean, so the technology's there. Tell me what you need, what's safe, and we can make any room meet those requirements right now. The problem is we don't have the standards, that we're not getting the information flowed to us that says this is what you need to do to reopen. Harvard has released a risk reduction strategy for reopening schools, everything from safety meetings and education to, what we're going to tell the students and parents outside of the classroom, to temperature checks, personal habit changes, airflow improvements. The green building push for years has been, let's reduce the increase the energy efficiency of buildings. The unfortunate aspect to that is that to clean and bring in outside air is not energy effective. So that has always been something that's kind of taken a back seat. Now, the new green building push to add plants and other green materials improves the IAQ of those buildings, or the indoor air quality. But for the most part, it's something that has to be done and designed into the HVAC system. And it's something, that you bring a company like Dan's or Ashish's in, and they'll tell you exactly what you need to do in order to, kill the virus in your system. The thing that I like to tell people is that UVC will kill viruses and bacteria, and it will clean anything that will make you sick, but it doesn't clean particulate, and it doesn't take chemicals out of the air, and it doesn't do anything about CO2. And that is a general IAQ thing, that aspect that needs to be brought to the forefront, especially in our schools. There's studies that show cognitive abilities increasing by up to 100% by reducing CO2 levels and improving the indoor air quality in companies, businesses, and schools. And I think that if we can start showing people a direct bottom line impact to the improved air quality that we can provide them, that we can prevent the next pandemic, as well as increase everybody's health.
So maybe I'm going to start sort of throwing these open to anyone, and I will also mention to those watching that you can put something in the chat if you have questions, because this is, we recognize as technology that, that medical facilities, and as Joe just said, other settings have been using for a long time, but it might be kind of new to many of our commercial building owners and to those that are working in those buildings. But so I want to get an idea, if somebody owns one of those buildings, or somebody's working in one of those buildings and maybe has some UV for the energy efficiency purposes that Joe and Dan mentioned, what do they do to sort of adapt their system to to deal now with risk reduction of viruses, which probably wasn't necessarily on the radar beforehand? So how would a building owner or an employer, how do they start tackling that question? What should they be thinking about?
Can I go first?
Sure, Dr. Ventura, please.
Okay, so we know that the virus can be transmitted through surfaces as well as through air. So the approach with building managers would have to take is not just one approach, right? It has to be a multi-barrier approach. So you have to look at isolation strategies. Suppose, assuming that it's going to be occupied, these spaces are going to be occupied. So you're going to have isolation strategies in place, like face mask and social distancing. And then we have the infection control strategies we're talking about here, which would be ventilating, diluting the air with fresh air, bringing in filtration technologies and UVC. So it has to be a multi-approach, and the application which the building owner would have to consider is basically how do you deploy it across the building. So there are two approaches, and I think you need both. One approach is facility-wide. What can we do facility-wide? So I think that points towards, okay, what can I do inside the HVAC system? So the HVAC system that Dan and Joe talked about, okay, you can install UV lights for cold cleaning. we can increase, if you have a UV system just for coil cleaning, it may not be powerful enough to treat the moving air. So you can adapt your UV system arrangement by adding more UV lights so that you can get the right amount of energy required to disinfect the virus. So that's more at a facility-wide application. So you can improve your filtration. What the IAQ industry is recommending that you should have at least a high efficiency filter like a MERV 13 or even a HEPA, but MERV 13 seems to be doing the job and it's recommended as a minimum. And and the difference between a filter and UVC is different. The filters are actually capturing the particles. UV is actually inactivating them and making them harmless. So of course, you are better off if you have both technologies, but as a first layer of defense, you should have the filters in place, which are high efficiency filters. Then you need to start focusing on local area. Okay, when you have occupied spaces, you have students in a classroom or people in retail stores, what should you do there? Of course, people in healthcare settings use chemical cleaners, chemical disinfectants. Maybe that's not something which is practical in an occupied space. So you got to use something which is green and more which can be mounted. So again, for local spaces, the approaches would be similar. What can we do for surface cleaning? For surface cleaning, people are using portable UV disinfection devices in hospitals today anyways. And you might have read about UV robots, which have been now deployed in grocery stores and retail settings. UVDI just announced a partnership about a few weeks back with a company called Badger Technologies, which is basically a UV disinfection robot, which you can deploy in a grocery store, and it can run on a battery for several hours and treat a 40,000 square foot facility. So that takes care of your surface disinfection. So what do you do about the air locally? So that's where people are now looking at air purifiers. So commercial grade air purifiers have at least a good high efficiency filter, and with an added option of UV, if it's possible, would of course increase the safety which that appliances is offering. The advantage of these air purifiers is that they run continuously 24/7, and they would continuously reduce the pathogen load on surfaces or in the air and keep on making it clean. So that's one. And then, like Dan said, upper air disinfection is also being used for local air control. So you can have the UV systems installed in the upper part of the room, but it's really important to make sure that the occupants are not getting exposed, so these installations are correct and safe to use.
So Dan, pick up on that a little bit, because Dr. Matur just laid out a couple of different technologies, HVAC, some of the robots, the upper air purifiers. If somebody, some of the people who are listening, are either working in the space or they own a building, how do they decide which is going to give the most bang for their buck? And where do they start? Does it do with how many occupants are in the room? Does it do with how big the room is? What kind of things should they be thinking about as they start to contemplate these solutions?
Was that to Joe?
Well, I was going to give it to you, Dan, but I can talk to Joe.
No, I definitely agree with Ashish, and I know Joe agrees as well. It's a layered approach, as far as dealing with spaces, dealing with buildings as a whole. I think, the filtration side, as Ashish mentioned, the CDC, ASHRAE, which is our trade organization, recommends that MERV 13 filter, at a minimum. And sometimes that can be hard to apply on existing HVAC systems where they can't handle that pressure drop. So they don't have a big enough fan to push the air through that filter. So that's where, UV can come in and do it. So, it's difficult when we talk about upper air, we're talking about room by room. Whereas when we're talking about the HVAC system, you're treating all the air in that space. So depending on the type of building, there are regulations on how many air changes per hour that you want to get in that space, and that's driven by the number of people in that space. So an office building versus a hospital or an isolation room. So an isolation room, you're looking at somewhere in the range of about 12 air changes per hour. So that the complete volume of that air is being turned over all those times. So in an office building, applying UV to the HVAC system, and as you were talking about, Holly, there are places that already applied UV primarily for coil irradiation. So, and as Joe mentioned, you don't need as much UV to irradiate something that's sitting there 24/7 in front of it. So we've seen applications where they've actually come back to those applications and increase the amount of UV in those spaces in order to try and do something in the moving airstream, or on the fly, as we call it. So I think that is, probably the best, broadest way to cover a building environment is at the central air conditioning system.
So you're in the HVAC, you're upping the amount of UV that you might have been previously installed in order to basically catch the air that's going by, which, as opposed to just focused it on the coil. What's the history of using UV for that energy efficiency? So here in Santa Cruz, obviously we've been building, we have a lot of newer buildings. Are they likely to have that? And when did, and if it was a building built in 1970, not as likely? Kind of, what's been the history of, engagement of this in the commercial space? I know there's a lot of engagement on the medical hospital and medical facility space. And I'm going to toss that to anyone who might know the answer to that.
Yeah, it's,
Well, a quick shot, and then Ashish, you can jump in, or Joe, real quick. As Ashish said, and as you kind of indicated there, the medical space, the hospitals, they were the early uptakers of using UV in their HVAC systems. And we've seen probably in the last 5 to 10 years an increase in the use in commercial buildings. And kind of going to what Joe is saying, this kind of greenifying these buildings, the goal is to try and reduce energy use. And so UV kind of slid right in there and can make that coil more efficient. And be a better heat transfer, less pressure drops, so take less energy to cool the air. And that was already on the upswing. And just having COVID come in has supercharged the use of UV in HVAC systems.
Yeah, and if I could add too, the big thing about UV, and it's energy cost. It's very costly in terms of energy to bring outside air into a building, because you have to condition that air. So if it's hot outside, you have to cool it. If it's cold outside, you have to heat it. And in order to bring that air into the building, you also have to expel already conditioned air out. So the use of UVC and filters is actually more efficient than actually bringing that air in, because it gives you a more consistent return air or room temperature that you can size your systems from.
With everything except a couple states in a very cold situation right now, I totally can see how that would be more efficient. Joe, continue on talking a little bit about the filters. We talked about MERV 13 and HEPA filters. And Ashish mentioned the air purifiers. So what about in people's homes? What can they be looking for in their homes? What are the things? And we've seen these UV light wands, which I'm pretty sure are not real, because you shouldn't be in the room with it, right? So what should they be looking for in a small space or their home? And how do you detect what's real and what is sort of being exaggerated?
In general, if you can see the light, then it's not real UVC. If you can see, you might be able to see it reflected off a wall or something along those lines, but if you can see the light, or it's light, or you can shine in your eyes, it's not real UVC. It's a gimmick. Dan, Ashish, I think you agree with me on that one. So I'll go on a limb and say that I'm right. But in general, UVC and filtration are actually two peas in a pod. They work together, in my opinion. As somebody who's looking at a whole room space or entire shelter, a whole system, It's, for a hospital, we do mobile medical shelters for surgical. UV light is a great addition to that product because it adds a layer of protection. No one technology is going to be your magic bullet or your silver bullet here. What you really should be looking at is what Dan and Ashish had mentioned, right, as a layered approach. And, you look at healthy habits, healthy buildings, healthy schedules, you have to rethink how we approach going into commercial buildings. And that's not just the HVAC equipment, it's the process of actually who goes in, when they go in, and how they enter and exit buildings. But ultimately, the technology's there. And like I said earlier, tell me what it takes to make a room safe enough, and I'll make it that safe.
If I may add.
Well, go ahead, Ashish, and then we're going to come back to that question.
So you're talking about residential environment. So I think the advantage we have in our homes is we can open our windows. So dilution is the best form of defense because you're reducing your contamination load if you can. So wherever you can, people recommend ventilation and dilution of the contaminated air is the best. And that's what typically air purifiers are doing. They are running it through the filtration system inside the air purifier, and the air is getting cleaner and cleaner. If you open the windows and door, of course, you're going to make that cleaner as well. Regarding the downside of hand wands is that even if hand wands may be considered effective, the claims are not very well documented. There are no standards out there. So even if it is producing a UVC light, two things can be happen. If there's a lot of UVC light, then there's a chance of exposure. So it's not safe. And if you don't have enough UVC light, it's not doing anything. So that's one of the disadvantages of hand wands. But for homes, I think that's why they say, what do you do about surfaces? Okay, we're talking about dilution, air, and air purifiers for the air. What about surfaces? How do you clean them? That's why people say, wash your hands with soap, wipe your counters with disinfectants. The good thing about COVID is that it's very easy to inactivate. So even the mildest disinfectant is going to, like an alcohol disinfectant, can get rid of it on a surface if applied correctly.
Not to mention with the air filtration units, or if you're actively filtering the air either through your air conditioner or with an auxiliary filter unit, you're creating an air current in the room or in the space that makes it more difficult for particulate that might be carrying the virus to land or sit down before getting pulled into the filter. So part of what we're trying to do in these buildings and making them healthy is also looking at the movement of the air in such a way that it's done to protect the inhabitants.
So there's been it sounds like there's been a lot of work trying to, both historically about viruses, different types of viruses, and now more recently as it relates to SARS-CoV-2, the virus that causes COVID-19. Who sets these standards? I think, Joe, you mentioned that the standards haven't really been fully set. And Ashish talked about that, the UV wands, may or may not be effective depending on for surface disinfection, depending on how they're designed and what the strength is. So who does that research? Who sets those, and sort of where do we think that's going overall in terms of people, if they wanted to make an investment in this, being confident that it's the right investment, it's going to work, so to speak.
Well, typically ASHRAE, sets a lot of these standards. As far as people looking to start retrofitting now, I'm cautious because, like I said, there's no standards yet. Nobody knows what they need to design to. So what I'm seeing on my side is you're seeing a hesitation from people to commit and spend a lot of money to retrofit buildings because they don't know what they have to meet. And so I'm working with people, and they're putting UV lights in their commercial buildings so that their tenants feel more comfortable. They're doing whatever they can because UV light is actually a very cost-effective retrofit. You can put those in ductwork pretty easily. You can put it in front of your coil pretty easily. But in terms of overall standards and what you would need to do for a building, I honestly don't know yet.
So I can add a little bit. So like you said, ASHRAE is probably the only organization which has got test standards. There are no performance standards, but there are test standards and there are guidelines on how to apply these systems. And so there are recommendations in ASHRAE handbooks. There's another UV organization called IUVA, International Ultraviolet Association, which, so between these two organizations, there's a wealth of data on what's a typical dose which should be applied and how, and for different microorganisms, which is the right dose. But the onus of performance validation really goes down to the manufacturer. So I think it's important for any building owner, building manager who's buying these systems should ask for validated data from the manufacturer because of the lack of standards. There are guidelines, but a common, like a building owner is not going to have the time to go through these handbooks and standards, right? So there are no performance standards. So I think the onus lies on the manufacturer to provide documented evidence of validation that, okay, as the system being applied to this application, this is what validation we have for the UV. For example, UV lamps, there are so many people who are selling UV lamps. There are some lamps which are really underpowered. They come from China, they work for 2 days, and then the power starts going down over time. So make sure that these UV systems have gone through the safety regulations. They have safety markings on them. At least the electrical, I think it's called the UL or Intertech or ETL markings from a safety standpoint. And then there are instruments and radiometers which measure the power of these systems when installed. So I would encourage all people who are planning to install these equipment to ask for validation by the manufacturers.
Yeah, and I would add just
do my quick plug that says all of what we're talking about here is manufactured in the U.S. and manufactured here in Santa Clarita, which is just a pretty amazing, that we have this this little group of companies here. But Dan, go on and continue, please.
Yeah, no, I was just going to say, along those lines, there's been a lot of technologies that have come into the market and have made claims, being able to do certain things, things that never had been claimed before. So, you really have to look at the, peer-reviewed studies that have been done, the history of the technology. UV goes back 100 years. There's been tons of studies, tons of peer-reviewed studies. That's all there supporting UV. You want to be looking for that on other technologies as well that are coming in saying, hey, we've got this thing and you can't see it, but it's doing amazing things. So just be weary of that.
And there's knowledge about what types of viruses it kills and bacteria, sort of historically, right? Like going back to, tuberculosis and such, if I understand that right. So we kind of know, we have a lot of history with this technology, I guess I'm saying.
Right,
Yeah.
so there's a lot of history and documented evidence. I think what Dan and I am talking about is it has to be correctly applied in the application. You can't just stick a lamp in there and say, hey, I got UV in my system and it's going to do the job, right? So you got to apply it correctly. What is the right size? We call it sizing of the UV system. So that's very important. You can't just stick a lamp in a duct and say, hey, I got UV, so it's going to work.
Yeah. And so building owners are talking to their HVAC engineer, their facility managers as their starting point. Would that be a fair assessment?
Absolutely.
Correct. Yeah.
Right.
Yeah, and I mean, air filtration equipment, if you're going to do a modular air filter, like a roll around or for your room, it'll be sized by the square footage of the room. It'll give you the air changes per hour for that space. So if you go to a smaller space, it'll get more air changes per hour, larger space, fewer air changes per hour. And you really can substitute air changes per hour through a filter with outside air, like Ashish mentioned with dilution. So it's, it's one of two.
So there's also been, I've got a question coming in about, and I've seen some signs for some restaurants that say they've got, ionization systems. What is that, and how, how does that relate to any of these other technologies? And I'm going to stick with the building owner or the employer, when they're looking at this layered approach that you're talking about, does that fit in, and if so, how? Recognizing I'm talking to a bunch of UV guys, so.
Right. So I can go first.
Okay,
if you
go
want.
for it.
Right. So ionization systems have been around. So it's not, I would say, a peer-reviewed technology. It's been around, and there are a lot of case studies indicating that they work in reducing the particle load, and it can basically apply a charge to a particle as it's coming close to it. So it applies a charge, and then the charges will just collect to each other, and the particle eventually falls down. Even though the technology has been used, there's not enough scientific evidence that it works in commercial environments. There have been studies showing that in a confined space, in a chamber, it does work, and there are different anecdotes out there. But all I can say is that organizations like ASHRAE are not really, are basically saying is, if you want to apply it, look at the data carefully, make sure it's safe, because some of these ionization systems actually produce ozone, and ozone is considered a carcinogenic. So you can't just apply it in an occupied space. Typically in an unoccupied space is where it should be applied.
So I'm going to go into, the questions are going to get harder, but I want to get to some of the real experiences of how much, and I get the layered approach. So you kind of walk me through some layers and hypotheticals maybe that a building owner or an employer company is going to think about. How much do things cost? And, and maybe that's a little bit of, if I'm in a set of, an office suite that's maybe, a few thousand square feet versus I'm in a large industrial building that has very high ceilings. And again, I know you're not going to have exact numbers, but just, what should those types of, companies be thinking about as they approach this and, are starting to decide how to create that layered approach?
Well, I can take a stab at that.
I know it's tough, and I know that there's a lot of pieces to that question.
Yeah, so a lot of it's driven by, unfortunately, by the specific applications that you walk into and sizing that system. Because when we're talking about, irradiating a moving airstream to disinfect it, Ashish was kind of alluding to it earlier, there's a lot of things that come into to get the correct dosage of UV for that. So if you have an HVAC system that has 10 inches of space downstream of the coil that you're trying to at 500 feet per minute, there's a lot of situations where you're not going to be able to do anything in that small of a space. So, or you have a little bit more space, but you need more UV versus a longer duct run where you might need less UV because you have a longer residence time. So it's going to depend on that specific application. From a coil irradiation standpoint, we would always talk, people would always say, well, how much does that cost? And again, every system is different, but in the range of 20 to 25 cents per CFM for coil irradiation. When you're talking about something on the fly, you're talking, double that or possibly more than that. And again, it's all depends on the different parameters of that particular system.
I'm going to say that you're going to need a unique solution for every building, just entirely. I mean, including the schools. You're not going to find a one-size-fits-all approach. And so the sooner that we can get started with this, the better, because it's going to take some engineering and some mechanical resources to get it done.
So if I can add, so when you talk about UV systems for facility-wide, of course, that's probably the best and the most economical approach because now you're going to treat the whole facility. But if you can't do that and you have to apply locally, and suppose you're using air purifiers, those typically run in the hundreds to maybe up to 1,000 for a decent sized system. So depending on how many units do you deploy, that can really add up very quickly. Upper air systems would probably be in that same range as air purifiers, I would say. But I think you can't do without one or the other. Again, it depends on what the needs are. If you are, like, for example, schools don't really have a centralized HVAC systems because the classrooms could be in parking lots or small buildings. So you can't deploy a centralized UV system for a school. You can probably do that in a building, and that would be more economical. But in schools, you got to see which one is probably the most practical to be deployed. If it's like a portable system, you're going to have a person who's going to take it from room to room. If it's a mounted system, yeah, you can do that, but you got to pay for the installation in each room. So I think at the end of the day, on a relative scale, a facility-wide adoption is, of course, the more economical approach.
And if I add one more piece, there's also a lifetime cost that needs to be considered as well. So these bulbs don't last forever. I want to say a good bulb, and please correct me if I'm wrong, a good bulb is about 2 years, I want to say. Is that correct?
Oh.
They're typically rated 1 year. Yeah.
1 year.
Putting out about 85% of their output at the end of 1 year.
So 1 year, and then your filters as well, whether you have HEPA or carbon. That's one other thing I wanted to add is there's another type of filter that's very important to indoor air quality, which is a carbon filter. The carbon filter will absorb inorganic chemicals like perfume, diesel exhaust. You think about the fires that we have here in California and the air quality that we're walking around breathing. The nice thing about an air filtration system in conjunction with UVC is it can protect the occupants from that nasty air quality that we often see here in California as a result of fires. But the replacement filter cost for one filtration unit, depending on the type of filters you have, not including the UV bulb, could be anywhere from $300 to $500.
Yeah.
If I may add one more thing. So if you apply a system in a centralized way, in a facility-wide, so we need to think beyond COVID as well, right? It is improving air quality, and it's not really designed only for COVID. The flu season comes in, so in buildings, school, people have associated attendance to air quality, right? So there's a direct link there. So when we go beyond COVID, I would say the value proposition of having a localized solution is not as strong as having a facility-wide approach, right? By putting it in the building, because you have a system is going to improve the overall air quality even beyond COVID, and you don't have to worry about the frequent replacement cost of filters for air purifiers, typically in room settings.
But I'd also just finally add that I think we're in a different age. I remember getting on airplanes and a few people would come on with masks on, and we look at them like, what are they doing? That's not an efficient mask. And now we're living in an age where, everybody's wearing masks. I would also say that, the infrastructure is going to be changing as well, because this is not the last, pandemic that we will be facing. I know Ashish has had this experience when SARS or MERS happened. Immediately there's an interest in what can we do? Can we apply UV? Can we do filtration? And when it goes away, everybody's like, oh, we're good. We don't need anything. But this is going to continue. And we've got antibiotic resistant tuberculosis. So the thought of that coming back, is a distinct possibility. So I think we're living in a different time. So I think, the move that Lorraine was talking about, where the city has taken the step to put UV into, most all of their buildings is a great step forward, and something that will benefit, everybody going into the future, whether it's flu season or another pandemic.
Well, and that is a great transition. Lorraine, question about, what steps has the city taken to implement some of these methods and technologies into city buildings?
Well, I'm really glad you asked. We have put UVC into our City Hall building, and we're working on the new Canyon Country Community Center as we build that out, as well as the Santa Cruz Valley new Sheriff Station. I believe it's also in our maintenance facility and one of our libraries, and we're working on other buildings. So our goal is to have it incorporated to all our city buildings and facilities. We have strong concerns that government should be able to make its facilities safe for our public and our staff. And I do want to point out one thing you've talked a lot about standards. And one of the critical things that's going to be really important is for us to get the message of the standards to the federal and state government so that they can send money our way, because there are dollars available that are there now, but they have to recognize ultraviolet technology so that it's useful in applications at the buildings where it's needed. And we really need to let our state legislators, as well as our Congress members, know that this is really critical. It's available. It's here now. And we moved forward as a city on it because we know this is the right thing to do for the public health now and forever, because you mentioned tuberculosis and other things. Some of these things are coming back. This is the technology that handles all of that. So you don't have to keep thinking, well, are we creating a new shot? Has that been tested? No, this is an answer that while you do have to maintain it, it's there for you and you don't have to worry. And I think we need to stay strong, and we need to stay away from vulnerabilities. And our goal is to never see a shutdown like this again in anybody's lifetime.
Yeah, if we bring those standards in, then we can create a pathway that says if you've come up with the layered approach with the right engineering, a pathway towards reopening very safely, not to mention all of the additional benefits that we've talked about in terms of, not having attendance problems and just the general benefits of indoor, high quality indoor air. I'm going to ask Peter to come back on and do a little wrap up for us. I want to thank everybody here. We are putting your contact info on the screen because we want people to learn more about this and realize the opportunities to start thinking about what they are going to need to do and want to do in their space. So I want to thank the panelists, thank Councilmember West for your leadership on this. And with that, Peter, I'm going to let you bring it home. Peter, you're muted.
Oh, still.
There we go. Now we're good. No, thank you, Holly. I want to thank everyone for joining us during our series. Again, as Holly mentioned, this is a third of three, and thank our speakers for being here as well. As Holly did mention, the past webinars are posted on our website under our COVID-19 tab on our homepage. During the pandemic, the Chamber, alongside the city and the EDC, we've been working diligently to bring necessary information and resources to our full business community. Our main goal has been to reopen our economy and get people back to work as quickly and safely as possible. As you guys have may seen, our Impact SCV, which is our grassroots program that we've used to lead the advocacy efforts for the business community. In the past, we ran a Reopen Santa Clarita effort. Currently, we're working with Six Flags Magic Mountain to urge the governor to allow them to reopen. We put an e-blast out on that earlier today, if you guys have seen, and urging, again, everyone to sign on a letter to help get the park back open. We have to find ways to ensure people can be safe at work, but especially inside of office spaces. And as you heard today, UV lights is one of the ways that'll help provide a safer indoor environment. we've been working on different approaches to reopen quickly, but again, just to ensure we reopen safely. So Holly, thanks again for leading this panel in this series as well. And thanks for all of our speakers, and thank you all for being here and participating. And we look forward to seeing you all soon.
Thank you.
Thank you.
Thank you.
All right.